Are there any negatives to doing a detox? Is there anyone that should stay away from it completely?
Well, I think it's not, I think there's no negatives. I just think maybe the length of time depends on the person and what's going on. A patient who's very frail and very weak might not be able to withstand a full-blown detox because you do feel worse before you feel better. Because when your body's clearing all those things, you are going to feel worse.
I'm Nathalie Sloane, Executive Director of the Institute for Neuro-Immune Medicine, and today we're exploring the fascinating world of detoxification. Joining us is Dr. Jacqueline Junco, an expert in integrative medicine, to help us understand how our bodies detoxify and what we can do to support this essential process. Dr. Junco is chair of the Integrative Medicine program at the Institute for Neuro-Immune Medicine, as well as assistant professor at the Kiran C. Patel College of Osteopathic Medicine. Welcome, Dr. Junco.
Thank you for having me, Nathalie. It's a pleasure to be here once again, and I'm excited to discuss detoxification, which is something so important that everybody needs to know more about because we are so misinformed and misunderstood of what the practice is and what the process is.
Right. So that's my first question. So detox is quite the buzzword these days. You can buy a detox anywhere on the internet or on social media. So what does it actually mean from a physiological standpoint?
Well, detoxification is the body's way of ridding itself from toxins. Now, I always say, one of the first, because there's 3 phases of detoxification, but I think that phase 0 is trying to avoid toxins should be number 1, right? So it's like eliminating being exposed, eating certain things, because we're constantly exposed to things either in our environment, in our homes, in our workplace, in the food we eat. So that's phase 0. And then it happens through 3 different phases. It goes through the liver, through the kidneys, the lung, the skin, and the GI tract. And then everything is going to be properly excreted the way it should be.
Mm-hmm. So there's a couple of things going on there. So one of the things that we cannot control, which is the environment, which is made worse in a lot of places by fires, toxins from fires, also mold from hurricanes, water. So what are the things that we can control? Obviously, a detoxification is more than just a juice cleanse. So what's the process and what happens in that detox process?
Well, we have to support it, because like what you mentioned, in the environment, it's hard to control the air we breathe. So that's when our lungs, it's going to come in through our lungs. So what can we do in that aspect? We could do some breathing exercises, right? We could try to neutralize certain toxins that way. Then the liver is very important, which is one of the first phases of detoxification, and it also has to do with what we eat, breaks down the products from the hormones we're exposed to, from, the pesticides we're exposed to, from plant toxins, from pollutants everywhere. So the liver is critical. In the first phase of detoxification is the liver activates the toxins. It activates it in order for those toxins to be oxidized in the next step.
So when you talk about toxins in the air and the environment, what kinds of things are out there that are unavoidable and what kinds of toxins can be avoided?
That's a great question, because I think that's very hard to say because we live in a toxic environment. I mean, just being in the buildings where we are, we don't know if we're being exposed to mold. The breathing, the EMF radiation that we're exposed to, does that affect our detoxification systems? Absolutely. The plastics that we're touching, the keyboards, the printer paper, all those things have chemicals that could interfere with the detoxification process. That's just in our work environment. Mm-hmm. And then, at home, we have the same issues, the things we cook with, the pans, the plates, the cups, the air we breathe at home. And then we have the outdoors, we have the pollutants, we have the environmental toxins that we're being sprayed, the pesticides in the ground. There's so many factors. I mean, we really can't get away from it.
That's true.
We just have to do our best to support our system to make it stronger to do what the body's intended to do.
Right. So, on that line of thinking, what kinds of nutrients or supplements are helpful for the detox or to keep yourself healthy?
Well, first and foremost, for phase one, which is where the body breaks, in the liver, it breaks down the fat soluble toxins into different metabolites. We need an enzyme system called the cytochrome P450. So that is very important that's where the B complex comes in. And we need antioxidants to help with that. Also, we need glutathione, which is one of the strongest antioxidants, also supports the methylation process. So there's a lot we can do. There's, eating cruciferous vegetables, eating broccoli, cauliflower, curcumin, black tea, turmeric. There's so many foods that could help, mitigate this and make it stronger.
Right. Are there better combinations of foods and antioxidants that are more optimal if you're looking to start this?
Yes. I personally, I'm a strong believer in, like, as far as foods, like curcumin and turmeric are great. There's black tea, it's great, and this is just things that we're eating, because of course there's other things that we could do at the different stages to help also, enforce like the sweating, which is also important. Okay. Because the skin is a very powerful detoxification. So using infrared saunas, going outside in the sun, getting, going barefoot out in the ground and getting some grounding. We need to feel the energy help us with the electron transfer from the ground to make our bodies stronger.
Right. So all you people that are going to the gym and not sweating, you should sweat.
Yes, sweating is good, which is where exercise comes
Yeah.
in. We need to move our bodies. You need to move, because
Mhm.
if not, everything is going to stay dormant, asleep. We got to get everything up and running. And I don't mean, exercise like running a marathon. I mean, that's great if that's what you do. But even if it's simple moves, stretching, walking, even 15 minutes outside would be phenomenal. Or if not, if you can't do it outside, even just getting up from your desk, from your work environment, and just moving, instead of sitting the whole day for 6, 8 hours, get up 10, 15 minutes, take little breaks, walking, movement, that helps with the lymphatic system. The lymphatics are part of the detoxification process.
Right. So in this phase one, are there any stressors that we need to watch out for or any risk factors?
Well, if you have a problem with methylation, now we're able to see patients who have the genetic mutations. There's certain things that we could test, that we do test for genetic mutations of the cytochrome P450 enzyme system, which is very big nowadays. Now we're able to detect so many different gene SNPs, which are little, like exactly what it says, SNPs. They're just little SNPs of that gene, which could cause problems. So those patients could be identified just with a simple test.
Mhm. And what kinds of physical symptoms should you look out for to see if you have this?
Well, it could be anything from autoimmune disease to skin rashes, trouble breathing, joint pains. It could be heart, cardiovascular effects. It could be GI manifestations. I mean, it could manifest anywhere in the body. It depends where your body's going, where all that inflammation and all that oxidative stress is going to. It could be the brain with brain fog, which is very important.
Right. So someone that has an immune system that is not as strong as another person would obviously have more severe symptoms and would be easier in a way to tell that there's something wrong.
Right, because they're already suffering from the oxidative stress is impaired. Their mitochondria are weak.
Mhm.
So we need to get that into an optimum state.
Hey guys, it's Haley again. Right about now, you might have questions that pertain to you and only to you. Let's continue the conversation. Go to haleypalmer.com/member and get a free 30-day trial of my membership community. You're going to love this place. Post your questions, ask your questions, grab some downloads, and let's get you the help you deserve.
So let's move on. What is phase 2 of the detox process?
Well, phase 2 is the after effect of phase 1. So this is where there's conjugation and the toxins are neutralized.
What does that mean
And
to the layperson?
it's made, the toxins are made into water soluble, so
Mhm.
that therefore your body could excrete it either through the kidneys, through the lungs, through the GI tract.
Okay, great. Okay, and what kinds of nutrients support this process in phase two?
Well, there's foods that are good for that too, like garlic. Again, the cruciferous vegetables, the curcumin and turmeric are good for every phase. And things that enhance the glutathione pathway, like selenium, bone broth, the NAC, which is NAC, which is a great precursor to glutathione, omega-3s in the form of eating fish. All those things help.
Mhm. And what
Eggs.
ag is great. So what happens if this phase is impaired in any way?
Well, then back to the same scenario, you're going to have more inflammation. It's going to lead to toxin buildup. You're going to have more inflammation, more chronic illness, and whatever manifestation, whether it's joint pain, headaches, brain fog, autoimmune disease, it's going to get worse.
Right. So let's move on to phase three. What role does this phase play?
Well, that's phase 3 is the elimination. So that's when everything gets hopefully eliminated. And that's where sometimes people have issues with. So we want to make sure that everything that's was worked on in phase 1 and phase 2 gets properly eliminated through the kidneys via the urine, or through the skin via the sweat, and then through the bile in the intestines through your poop or feces.
Right. So someone that doesn't live in South Florida that can't come to the Institute that's interested, what kinds of questions can they ask their physician or practitioner if they're concerned with their health or they want to go through a detox process?
Well, I think it depends what the underlying condition is and what the symptom is. I mean, I just think that overall, there's tests that could be done. You could do the MTHFR, you could check a glutathione panel, check their antioxidants, check for mold toxicities, check for the other heavy metals, things that all these things that are accumulated in our bodies and our toxins.
Mhm.
So checking, heavy metals, molds, and then just a baseline blood work so you can see what else is impaired as far as methylation, glutathione.
What would be a process for people to start a detox program once they've established that it's necessary?
Well, I think the most important thing is to focus on good foods, whole foods, organic foods preferably. And I know that's an issue for a lot of people because of the cost. But I mean, as long as you try to eat, as whole plant-based, and I do tend to go more plant-based, because plant-based, you're getting all the rich antioxidants and the polyphenols and all those wonderful good things from fruits and vegetables. Staying hydrated, drinking good quality water. Okay, so the water should be tested, because that's another issue.
That is an issue. And actually, that's a big issue because I think that there is a huge push for designer water. And I think people purchase water based on marketing and very good marketing. So, how do you know what's good water and what's not good water?
Well, you got to get your water tested. I always recommend to patients or, friends and colleagues or whoever asks, get your water tested. It's easy.
Mhm.
There's a lot of places that do it, and then you could check for heavy metals. You could check for make sure it's alkaline. The more alkaline, the better.
Mhm. And when you go out and you buy a bottle of water, which we're trying not to do, so we don't want to fill the earth with plastic, but what are the ingredients? There shouldn't be really any ingredients on a water bottle, but what are we looking for when you buy something in a store?
Well, first of all, you want to try to get alkaline water. Now, it's hard to say if it's really alkaline because we don't know what they're putting on there on the label. Is it really what it matches the content unless you're going to go get it tested?
Mhm.
But preferably alkaline water, and in a glass. I would not recommend plastic, even if it says BPA free, because you never know.
My name is Jimmy Orocho. I am a veteran of the 1990-1991 Persian Gulf War, Desert Shield, Desert Storm. I work for Dr. Nancy Klimas at the Institute for Neuro-Immune Medicine in Nova Southeastern University. We are in Davie, Florida. We are Gulf War illness clinical researchers in the need for research participants. By participating, you will help yourself and your fellow veterans, contributing to the discovery of the cause of Gulf War illness and how to best treat the illness. Our telephone number, 954-262-2870. Our email, Quick Tick, Golf Whiskey India Charlie, Tango India Charlie at nova.edu. We do also decentralized clinical trials. That means that you may be able to participate in this research from your hometown. Thank you very much.
Let's talk about practical advice for people. Let's say you wanted to start a new diet to support your detox, to be more healthy, to fight inflammation. What kind of a dietary menu are we looking for, perhaps like in a day?
Well, again, going back to more plant-based, whole foods. And then as far as, supporting the liver, in Chinese medicine, which is part of what I studied, we say, the liver is very important. The more greens, that's the color that you need to eat for that organ. So greens are good, all the leafy greens, kale, collard greens, Brussels sprouts, all those things are wonderful for the liver. So all the greens are great. Again, hydration, fiber is very important because in the other part of the elimination is the pooping. If you can't poop, you're going to keep all those toxins in. If you don't sweat, you're going to keep. So it's bad enough, people don't move, but if you don't move and you don't poop, then you got two negatives. So
Right.
Eating, so you're really going to have all that work that phase 1 did. It's all just going to be lurking around.
Right. That's true. You're kind of a battle uphill.
Yeah. So you have to make sure you poop and sweat. So eating fiber, eating rich in fiber, and then you could take some herbs. There's good herbs, like, there's Chinese herbs, but there's also good, like milk thistle, dandelion, black tea. All those things are great as far as, natural things that you don't have to take any, like external fiber. I mean, you just eat everything and drink teas.
Right. So let's talk a little bit about the other things that you do here at the Institute that includes Chinese medicine. How does that aid in detox? And what's the kind of regimen that you would start with a new patient should they come in?
Well, I incorporate acupuncture because acupuncture works not only bringing your body into that parasympathetic effect, and by that, you're going to decrease inflammation. It's going to help with the lymphatics. It's going to help with the circulation, which is part of the thing we need. We need to move that lymph. We need to move the lymphatics. We need to work on inflammation. We want to work on the parasympathetic nervous system. So that's the beauty of acupuncture. I also, work with patients with breathing exercises, teaching them how to breathe, getting, that breath work done, and releasing that CO2 on your exhalation is very important for detoxification.
Right. So all of that is connected to detox, the elimination of bad, not water, poop, or whatever in your body, as long as bad air, bad energy, all of that helps in the healing process and in order to keep you healthy.
Right. And then one other thing that I always target is sleep. I always make sure, and that's one part of the exam when I see the patient, one part of the history, we talk about sleep because sleep is critical. When we sleep, your body detoxifies. Your liver between the hours of 1 and 3 a.m. is when it's more in Chinese medicine, and we see it in the biological clocks. That's when the liver's most active. So you need to sleep. And then obviously sleeping between 7 and 9 hours, and also for the brain detoxing. Now we know more about the lymphatics, which is the brain detoxification pathway. All those proteins that are there and all those toxins get accumulated. If you don't sleep enough, that's not going to happen. And I always hope, another way to work with that, if you don't want to exercise, stand on your head. You used to do headstands like we used to do like as a kid. Just or get on one of those inversion tables and invert yourself, just bring more blood flow to the head.
That's interesting. So that is one of the things I know that we've started here at the Institute that affects PTSD or veterans with Gulf War illness, is that inability to sleep and rid the brain of toxins.
Right.
Right. So what happens if you can't sleep? How do you relax yourself enough? What can you do at home on a daily basis to be able to get yourself into a state where you can have a restful night?
Why? One thing is first you see what's going on, what phase of the cycle. If they've had a sleep study done, then you try to identify, what sleep cycle is impaired. Is a REM sleep, is a deep sleep that's usually an issue. So then, I always start, breathing exercises again. Yoga Nidra, which is a form of yoga and meditation that should be done at bedtime for those patients. It has very, very good results. Acupuncture, again, I did a study at the VA working just on PTSD using just auricular acupuncture. And the results over those 6 months were amazing. The veterans were sleeping longer and they were able to get off some of their sleep meds. I mean, it was an amazing result.
Yeah.
So acupuncture is great. There could be some supplements, magnesium works great for that. And then obviously a healthy diet.
Right. So let's go back to acupuncture for a second, because I think that a lot of people don't understand how it works. Can you talk a little bit in basic terms about how acupuncture works and why it's so potent for someone?
Well, especially for patients with chronic illness, one of the most things that we see, is the immune system disorders, right? So one of the beautiful things that acupuncture does, it brings your body into that parasympathetic state, meaning, we're always in that fight or flight, where our brains are, we're always like being chased by a lion. This does totally the opposite. So it brings you into the relaxed state where all the healing happens when you're in when your vagus nerve is activated. And that's what you want.
Mm-hmm.
And aside from that, and, it helps in circulation. Now through functional MRIs, we see that when needles are placed in certain body parts, that area gets more blood flow. There's things released in the brain, like natural peptides to help with the pain signals, helps with the endorphins, the enkephalins, helps with the sleep cycle. I mean, it's amazing the results that we're seeing.
It is amazing. Yeah. And there are actual studies that prove that this actually works.
Yes. And for stress, I think stress is one of the major things. For me, stress is the cause of every illness, because it's one of those root things that if you don't target the stress, you're never going to get to the solution.
It's true. And I think that
you can keep putting layers on it, but you're not going to fix the problem.
Right, which is what makes this process of detoxification so important. That releasing the stress, making sure that you're taking care of yourself and doing it in a way that is planned out, that tells you A, B, C, these are the things you have to do. Not only does it detox your body, but it detoxes your mind as well.
Right. And I mean, there's things, there's other things to do for detoxification. Once you're at that stage, you could take binders. There's great binders, with either charcoal, fulvic acid. There's a lot of different companies that sell these, binders to help bind those toxins and help the process of elimination. But you still got to poop and sweat, because if you don't, you could take those binders and it's going to be, they're going to be free, but you got to eat that fiber. You got to move. You got to either get in a sauna or move, because you got to let that out.
Right.
There's even people that recommend coffee enemas as a detoxification. And the pathway with coffee has to do with the glutathione pathway. So it helps with that with phase 2. Mm-hmm. So it's very, a lot of people, a lot of my colleagues in the integrative medicine field do recommend coffee enemas. People, you say that sometimes people are like, what? It's a little out there, but hey, it works. Some people do get relief from that.
Mm-hmm.
Plus it helps you poop.
Correct. Whether you want to or not, I guess you're going to get
right.
Yeah. So, what would you say are the biggest takeaways for people when it comes to detox? What's the first step? What do they do? How do you get your mind ready to go through something like that?
Well, I think first of all, it's a process. It's not a quick fix. You have to mentally prepare yourself for the journey of detoxification. You got to set your mindset that, okay, I'm going to start eating, more whole foods, more fiber-rich foods. I'm going to hydrate more. I'm going to go out in the sun. I'm going to sweat. I'm going to poop. I'm going to take certain supplements if needed. Some people do well, like taking glutathione. They take alpha-lipoic. They take different. If you need a supplement, that's fine. Mm-hmm. And then the healthy habits, you could, dry brushing is good, because dry brushing also helps with the lymphatics.
What is that exactly?
You get this brush that has usually some bristles, some cow bristles, or that hair that's really coarse. And then you just go up and down your arms and all the lymphatic chain. You brush it dry. It's dry. So it's going to you feel the effects. I've done it. I don't do it as routinely as I should, but I have it at home. But it's pretty interesting because when you do that, your whole body is like tingling. So you feel the lymphatics working.
Sure.
And
That's
you do it
interesting.
from the bottom, you do it from the bottom of your feet all the way up.
Interesting. I don't think I'm very few people probably think about dry brushing as kind of a therapy.
Yeah, but it is. I mean, people have been doing that for centuries.
Mm-hmm.
It's just that we don't see it as one of those things like,
Traditional.
oh, sure, let's do that. What are you gonna do? I'm gonna go dry brush. No.
Well, that's true. I mean, I think that that's why, acupuncture and other non-traditional sorts of therapies really get a bad rap a lot of the times. If people don't understand them, they don't understand that they've been around for centuries and they don't know how they work, which is why I ask, if you explain to people how these things work, they'll be more open to trying them.
Right.
Right.
Absolutely.
So I think even the process of detoxing is something that people pay very little attention to, nor do they understand how incredibly helpful and life-changing it could be.
Right. And then, sometimes, you also have to, there's a lot of toxins. I mean, it's not just what we mentioned, like the air, the chemicals that we're exposed to, but I mean, just food additives is another thing, because that is also a big thing. The drugs, we see patients that they're taking poly drugs. I mean, they come in to see us and they're on 10 medications. All those medications have to be detoxified in the body. They're metabolized through the liver to the kidney. So that's going to impair that kidney and that liver from functioning. So doing a good detox, I recommend people undergoing a good detox for at least 2 to 3 weeks, at least once a year, especially if you're taking so many medications, because all those things are going to impair.
So if someone is looking for an actual step-by-step instruction of how to do a detox, what do? Do they Google phase 1 detox, or how do you get started?
I would go, a lot of providers don't really do too much with detoxification. So they will send you to some, a clinic like ours who work like in functional integrative medicine. But some nutritionists that work with functional medicine are also very well versed on detoxification. And yes, you got to be careful what you listen to on the internet, even though you can't. I mean, they're not going to really, I would say very rarely have I heard something that's been negative on detoxification on the internet or podcast, because it's all going to be good information. It's all going to be the same thing: eating the right foods, hydration, movement, pooping, sweating.
Right.
And then obviously the things, if they're trying to sell their supplements, that's fine. But I mean, it's there, but just as long as you know the basics.
Right. Are there any negatives to doing a detox? Is there anyone that should stay away from it completely?
Well, I think it's not, I think there's no negatives. I just think maybe the length of time depends on the person and what's going on. A patient who's very frail and very weak might not be able to withstand a full-blown detox, because you do feel worse before you feel better. Because when your body's clearing all those things, you are going to feel worse.
Right.
You can feel worse.
Right.
And they're like, oh my God, I have a headache. Okay. But that's part of the process.
Mm-hmm.
And some people might not be able to tolerate that.
Sure. So a lot of the patients that come through our clinic are chronic illnesses that they've been with their whole lives. They have multiple different things that are going on, multiple medications, as you mentioned. How do you break that down for them? Is it more than 3 steps of 3 phases, or do you just do it very gently in the same way?
I would say do it gently. And then, just taking a detailed history like we do, seeing what they're currently eating, seeing what their currently lifestyle habits are. If they drink alcohol, if they drink too much coffee, what is it that's going on that we could work on first before having to drastically go into a detox protocol. I mean, there's changes you can do just with the nutrition to start getting them to where they need to be, and do the process slowly.
Right.
Unless, of course, they have like a heavy metal toxicity or mold toxicity, then you really got to hit them with the big guns, because
Right.
you don't want to stay with that.
But we would do some tests here at the Institute in order to pinpoint those kinds of toxicities.
Right, of course.
Right. So let's talk a little bit about things that you have in your home that could potentially be toxic or in a toxic place that people may not think about.
Well, I think everything is toxic, and it's sad to say, but I mean, we start from the morning, you turn on your water, you brush your teeth. I don't know, the toothpaste you're using, then the deodorant you're using, then the perfumes you're using, what scents are there? What does that have inside? You have to start looking at labels. The EWG, the Environmental World Group, puts out a great pamphlet for the public to look at, and it has all the good and bad things that you could be, either perfumes, everything for the home, for your own use, for personal use, for foods. And it's a great thing to have, because there you could say, wow, I'm using Lysol as a cleaner. Wow, Lysol is in F. You should stay away from that. And then it gives you, maybe you don't want to go, because some people like to clean with bleach. Bleach is not the best thing, but I think bleach is like a C in the rate from A to F. But still, there is A. So if you're very, very sensitive, you don't want to be consuming
using enough product
and using an F on a constant basis. Now, it could be your shampoo, your conditioner, the soap. I mean, this is just on your own self. And, the skin is the largest organ in the body. You're going to absorb everything. You spray on that great perfume and you don't know what you're spraying on.
I think we're making a lot of people nervous right now, but it is something to think about. It is something to think about, the things, especially if you have a condition that is inflammatory or affects your immune system. If you have, then that is additionally something to be very careful with.
Right. And then, again, there's, the insecticides, the pesticides, the herbicides, all those things that are on the outside of your home that we're being sprayed with, and we don't know. So, I mean, if we could minimize what we do at home, that right there alleviates a big problem, because every day you get up in the morning, you have a routine.
Mm-hmm.
The sheets you sleep on, are they cotton, or do you dry clean your clothes? Because that's another thing. Dry cleaning is not the best.
That's true. And I think that one of the huge misconceptions when someone comes into our clinic, for example, with chronic fatigue, is that they have been told over and over again that it's in your head. There's nothing wrong with you. You're just tired. You're just lazy. And for people like that have these constant issues with brain fog, or people that can't get out of bed, that have been told for so many years this is all in your head, this is something that you can really will impact your day to day. That is a fairly simple thing to do, to remove these things from your home.
And it is easy, because if you could eliminate those things, then right there, you have half the battle, more than half the battle won, because it's your body. You're exposed to these things on a daily basis.
Right.
And those are the things that you put on. Then you have to go into the foods, start looking at labels. If it contains more than 2 or 3 ingredients, you shouldn't be putting that in your body.
Yeah, that's a great way to look at things. Actually, one of the things that I learned when I first started working here was that specific thing, that if something's got an entire paragraph full of ingredients that you cannot pronounce, you probably stay away from it.
And especially numbers and colors and things that that shouldn't be going into your body. Now, that doesn't mean, that every now and then you want to have something that you shouldn't have, like a drink of alcohol if you're talking, but that's okay, because, we do live, and you have to live your life. And if that's what you enjoy doing, then that's fine. But I think you have to balance and see what's going on, especially if you're sick. You don't want to continue to get sicker. You want to get better. And that's what we try to help the patients do.
I think that is something that's hard to process, is the idea that the things in your environment that you've been doing all along are actually affecting your health. And for someone that's healthy, like you said, it may not make a difference, but for people that really have chronic illness, it makes a huge difference, and is probably something that they don't think about.
Right.
Right. So in addition to the detox, with the detoxing your body from the inside out, also detoxing your body from the outside in.
Absolutely. And then, there's other things. We're in an osteopathic medicine institution. Osteopathic manipulations are another form of moving. It's not acupuncture. Craniosacral therapy is also very good, because that helps move the lymphatics in the head and neck, which is very important, especially for eye patients who have, the brain fog. I mean, there's so many things out there. We could help some people if they were just more informed and, willing to come in and we could really help them.
We could. Can you describe the difference between osteopathic manipulation and going to a chiropractor, for example?
Oh, well, it's first of all, the schooling itself is night and day. I mean, an osteopathic doctor has gone through medical school like an MD. So they're considered like a medical doctor. It's just a doctor of osteopathy. They focus more on the spine and its relationship to every organ in the body. So a chiropractor is just, the cracks here and there. And I think there's some chiropractors that are very good, but I think it's a night and day situation as far as like their training and their goal, because the osteopathic doctors see the patient the same way we do as integrative medicine. It's mind, body, spirit.
Right.
So we're looking at the connection between the brain, the body, the nervous system, and they look at that, which is very important.
Yeah, I mean, I bring that up really for that specific reason is I think that a lot of people have never heard about osteopathic manipulation. They don't know how it works. Much like acupuncture, it seems very new world. So I think it's important for people to understand that there is another modality that perhaps they've not looked at, which is osteopathic manipulation, how that really could affect them positively.
Right. And it could help in so many ways. I mean, a lot of our patients have a lot of chronic pain. So that's another wonderful thing that osteopathic manipulations help with.
Sure. And I think that, again, to go back to chronic fatigue, one of those things where people are told this is all in your head, you're so tired all the time. Osteopathic manipulation is a really good tool to get past some of that.
Absolutely.
Get past some of that. So, well, I want to thank you so much for your time today. This has been a really, really interesting conversation, and we hope to have you back sometime soon.
Thank you, Nathalie. It's always a pleasure to be here and try to get the word out and, bring some hope to these patients who need it so much.
Yes.
And we're here to help in any which way we can.
Thank you so much again.
Thank you.